Hi, I'm Brad Kropp, Medical Director at OKC Kids Urology in Oklahoma City. Today I wanted to introduce you to the whole concept of the exstrophy complex, because if you're viewing this video, it's probably new to you. You may have a brand new newborn baby, or maybe just heard about these terms. You may be a nurse or another provider. So again, let's look at the whole exstrophy epispadias complex. So again, if we look at it, we have the exstrophy complex. Okay, and out of this we get three different diseases that you'll see on our app. And again, so not every patient that's born has all of them, and some of them have just different components of it. But essentially, the most common, is going to be bladder exstrophy. And this is when the bladder, so the bladder is open. Those are the ureter tubes. It's open to the skin. It's sitting on the anterior abdominal wall. You can look right down inside of the bladder. The pelvis is also spread apart. The urethra is split, and the penis is split, and the vagina is open, in that area. Okay. The second thing that you can have, which can be included in bladder exstrophy or can be isolated alone, is epispadias. So epispadias only involves the urethra and the penis and the urethra of the female. And so typically you're going to have a urethra that goes all the way out to the tip of the penis, kind of thing. But in a epispadias patient, the urethra is either open up here below the head of the penis, it can open in the middle of the shaft of the penis, or it can open right down here at the penopubic junction, right at the pubic bone area. And that will allow the urine to leak out. So each one of these is different severities, and each one requires different types of repairs. But this is an epispadias. Now, almost all exstrophy patients will also have epispadias. Okay. Then the most rare and the most complicated is what we call cloacal exstrophy. That has bladder exstrophy, epispadias, and now also the colon, so also involves the colon and rectum. So now what you're seeing is the bladder is open, the urethra is open, the penis is splayed open, the urethra of the female is splayed open, the vagina may be duplicated, and in addition, you have a minimal amount of colon development. The colon is open, there is no anus, and so this is much more involved. Typically, this will look like you'll have one bladder half here. You'll have the colon in between here, so this is our colon. You'll have a couple of appendixes, off of here typically. And then you'll have the other half of the bladder on this side, like that. So these will be bladder halves. The penis will be separated into two different parts. The clitoris on a female will be separated into two different parts. And then we have to take this part out, put the bladder halves together on the back side, and then we'll have to put the bladder halves together on the front side. Extremely complicated surgery here, and much more detailed. about that. So those are the exstrophy complexes. Patients can have different portions of it. The bladder can be more involved, the urethra can be more involved, the vaginas can be more involved, the clitoris can be more involved, the penis can be more involved, the sphincters are always involved, the ureters can be involved, the kidneys can be involved. Again, not every patient is going to be the same. It's going to be different parts of it, and so that's where where the surgeon should define each one is what your child's specific anatomy is, because that's going to be involved in the reconstruction of it all. So again, when you read in things and you talk to other people, not every patient is going to fall into the same thing. So what one child had, your child may not have, and what your child has, another child may not have. So again, my goal of this app is to try to educate the entire community about bladder exstrophy, as well as epispadias and cloacal exstrophy, so that we can communicate, to each other and gain information and move the field of the exstrophy complex further down the road, so that we understand things and can gain more information. That's the goal of the app. Thanks for watching. We'll have more videos later.